Bismillah Rahman Rahim. Assalamu alaikum. Welcome into the third episode of our workshop on management of diabetes mellitus during Ramadan fasting. Today we shall discuss risk stratification of diabetic patients regarding Ramadan fasting. We shall discuss what are the different variables, risk factors, and what is their weightage and how that is calculated to see whether the patient lies in the high risk group, medium risk group, or low risk group. With the help of this scoring system, you will be able to put your patient into the accordingly risk group and then advise the patient whether he or she should fast or don't fast. So we are in the third episode of our workshop on Ramadan and diabetes. And this is related to the risk stratification of individuals with diabetes for fasting during Ramadan. Risk stratification is an important step in the process of providing guidance to individuals with diabetes seeking to fast during Ramadan. It forms the basis of all subsequent guidance and decision making. Elements for risk calculation and suggested risk score for people with diabetes mellitus that seek to fast during Ramadan, they are 14. First, what is the type of diabetes? Type 1 diabetes or type 2 diabetes? What is the duration of diabetes? Then, presence of hypoglycemia, if a patient has experienced hypoglycemia or not. Then the fourth, level of glycemic control. What is the HbA1c level? Fifth, what type of treatment the patient is getting. For type 1, what type of insulin? For type 2, whether this is all oral or oral plus insulin. Then what about the self-monitoring of blood glucose, whether patient is doing this or not doing this? Then any acute complications the patient has. Then the 8, the major vascular disease complications or comorbidities. Then the renal complications or comorbidities. What about pregnancy, if it's a female patient, whether the patient has pregnancy or not? Then on 11, the frailty and cognitive function of a patient. Then the physical labor, what type of physical activity the patient is having during the daytime. And of course, the previous Ramadan experience, what was that? And the 14, fasting hours in that locality, how much is the fasting hours on average? So depending upon these 14 elements, the risk stratification of individuals with diabetes is done for fasting during Ramadan, and then accordingly the patient is put whether in high risk, medium risk, and low risk. So let's see how the scoring is done according to these elements. First, the type of diabetes. If it's type 1 diabetes, if the patient is having type 1 diabetes, he or she is given mark of 1. It scores 1. For type 2 diabetes, score is 0. Coming to the second component, duration of diabetes. If diabetes is for more than 10 years, 1 mark is given. And if it is less than 10 years, it is given 0. The third component is that of presence of hypoglycemia. If a patient has hypoglycemia unawareness, he doesn't know whether the patient has hypoglycemia or not, then it is given 6.5 score. If a patient says a patient has recent severe hypoglycemia, it is given 5.5 score. When there are multiple weekly hypoglycemic episodes, it is given 3.5. And if there is hypoglycemia less than 1 time per week, it is given 1. But if patient hasn't uh, experienced any hypoglycemia, it is given 0. Remember this, here the hypoglycemia happens, but the patient is unaware. Patient don't sense the symptoms and signs of hypoglycemia. So when it is that condition that hypoglycemia happens, but the patient is unaware or patient doesn't recognize, he is given 6.5 marks. So according to the presence of hypoglycemia, it may score 0 to 1, 3.5, 5.5, or 6.5. Now the fourth element is level of glycemic control. If it is more than 9, it is given 2 marks. If it is 7.5 to 9, it is given 1. When it is less than 7.5, there's no score given, it scores 0. So 0 for less than 7.5, 1 for 7.5 to 9, and 2 for more than 9. Depending upon the good control glycemic control, no score is given, and the poorly controlled diabetics, 2 score is given. Then comes the type of treatment. When the patient is having multiple daily mixed insulin injections, he or she is given score 3. When the patient is having basal bolus insulin or insulin pump, 2.5. Once daily mixed insulin, it is given 2. When it is basal insulin only, it is given 1.5. Similarly, if the patient is on oral and using glibenclamide, it is given 1 score. If the patient is on gliclazide or modified release or glimepiride or repaglinide, it is given 0.5. Other therapy, not including sulfonylureas or insulin, it is given 0. So the treatment for different types of insulin, different score is given, and for different types of orals, different score is given. Then the sixth element is self-monitoring of blood glucose. This is SMBG. Indicated but not conducted, patient is not doing, score of 2 is given. Indicated but conducted suboptimally, score is 1 is given. Conducted as indicated, the patient is willing, patient conducts this self-monitoring blood glucose, then there is 0 score. But when it is indicated but the patient conducts suboptimally, 1, and it is indicated but patient does not conduct, it is given 2. Then the seventh risk element is that of acute complications. If a patient has diabetic ketoacidosis or hyperosmolar hyperglycemic syndrome or hyperosmolar non-ketotic coma in the last 3 months, if there is a history, its score of 3 is given. When such history is, when the patient had such episode in the last 6 months, then the score 2 is given. When such happened in the last 1 year, then 1 is score is given. When there is no history of DKA or HHS, then no score is given. Going to the eighth risk element, that is the macrovascular disease complications or comorbidities. When there are no vascular disease or comorbidities, 0 score. When there is stable macrovascular disease, then score of 2 is given. When the macrovascular disease is there and it is unstable, 6.5 score is given. The ninth risk element is that of renal complications and comorbidities. When the eGFR is more than 60, no score is given. When it is 45 to 60, 2 score is given. When it is 30 to 45, then the 4 score is given. When it is less than 30, 6.5. So if it is severely impaired, less than 30, 6.5 score is given. When it is higher than that, the function is better relatively as compared to this 30 to 45, then 4 score is given. 45 to 60, then 2 score is given. More than 60, 0 score is given. Higher the score, higher is the risk. Coming to the 10th element, the pregnant ladies, female diabetic patient, not pregnant, 0 score, pregnant within targets 3.5, pregnant not within targets, the sugar is not controlled, it is given 6.5. Then the 11th risk element is frailty and cognitive functions. When there is no frailty or loss in cognitive functions, 0 score. When the age is more than 70 years with no home support, 3.5. When the patient has got impaired cognitive functions or frailty is there, 6.5 score is given. Then the 12th risk factor is that of physical labor. Highly intense physical labor, patient is having highly intense physical activity, 4 score is given. Moderate intense physical activity, 2 score is given. No physical labor, how the office job or something like that, or no job, then 0 score is given. Coming to the 13th risk element, that is the previous Ramadan experience. Overall negative experience, 1 score, no negative or positive experience, 0 score. And this is when how the previous year Ramadan experience was. The 14th risk element is that of fasting hours, location. When it is less than 16 hours, 0 score. When it is more than 16 hours, 1 score. So when you go through this checklist and then allocate the marks to that very particular patients, so depending upon the score, and this is the signal lights, when the score is more than 6, he or she is put in the high risk group where fasting is probably unsafe. And when the score is between 3.6 to 6, just like the yellow color, he or she is in moderate risk and where the fasting safety is uncertain. When the score is 0 to 3 or less than that, then the patient is in the low risk where fasting is probably safe. So if a patient has got more than 6 score and he is in the high risk, so fasting is probably unsafe, and you advise that patient against fasting. When it was in the yellow group, and the yellow group is, I told you, the marks, the points are the 3.6 to 6. So in this group, that is the moderate risk, the fasting safety is uncertain. The patient needs medical evaluation before Ramadan, medical adjustments, the treatment must be adjusted, and the strict monitoring is warranted in such patients. When it is less than 3, coming again, the fasting in this yellow group is that the fasting is preferred, but patients may choose not to fast if they are concerned about their health after consulting with the doctors and taking into account the full medical circumstances and patient's own previous experiences. So patient may say that I'm afraid. So it depends upon the patient will have to give the fidya and all that. So if the patient does not fast, they must follow medical recommendations, including regular blood glucose monitoring. But if it is the patient is in the green group, that is the fasting is probably safe. Again, the patient needs medical evaluation, medical adjustments, and strict monitoring. And fasting is obligatory in this group. Advice not to fast is not allowed. You ask the patient that they should fast unless patient is unable to fast due to physical burden of fasting or needing to take medications. These medications are so that you cannot change, and they are frequent medications. Or food or drink during the fasting hours. Otherwise, on medical grounds, patients must fast in this group. Then what are the key components of Ramadan focused educational program? You must have this program in your facility. And this should include risk quantification and exemptions and removing misconceptions. Second, blood glucose monitoring. Third is fluids and dietary advice. Fourth is physical activity and exercise advice. Fifth is medication adjustments and test for fasting. And then the when to break the fast, the patient should be educated on that, and recognition of hypo or hyperglycemia symptoms. This is the key components of Ramadan focused educational program. The self-monitoring of blood glucose. When to test, the number of blood glucose monitoring differs according to the case, and it may be the pre-dawn meal, that is pre-suhoor, then the morning, then the midday, then the mid-afternoon, then the pre-iftar, then 2 hours after iftar, at any time in between. So From these, you ask the patient how to do the self monitoring of blood glucose. So, the management of individuals with diabetic patient when fasting during Ramadan. Guidance on the management of diabetes must be provided prior to Ramadan, as I said. A pre-Ramadan assessment needs to take place ideally 6 to 8 weeks before the start of the Ramadan. Healthcare providers need to obtain a detailed medical history and perform a risk assessment. And this risk assessment forms the basis of all recommendations thereafter. These include advice on whether fasting is safe, strategies for dose modification, and treatment regime adjustments, the provisions of Ramadan focused education and nutrition advice. So, we shall discuss all these points in the next episode. Till then, take care, be with me, see you tomorrow in the fourth episodes where we will discuss all these points. Take care. Khuda Hafiz.